Good afternoon. My name is Carla D'Imperio. I'm the Director of Family Support for the Phelan-McDermid Syndrome Foundation, and I'm mom to Matthew, who is my 10-year-old son who has Phelan-McDermid syndrome. I'm excited to present the fifth in our Pathways Education Series webinars. So we've been offering these webinars once a month throughout 2025, and this month's topic is handling denials from insurance and Medicaid. And today I'm happy to have my husband, Michael D'Imperio, join me to share both as a prosecutor, sharing from his legal perspective, but also as dad to Matthew, how he has been successful in getting many fair hearings and other insurance processes approved for Matthew. So thank you, Michael, for being here with me today. What we're going to work on today and learn is basically how to prevent denials. That's a huge part of handling denials in the first place is figuring out how to prevent them from even happening, and then what to do if you are denied, and different strategies for appealing once you are. So, Michael, do you want to go ahead and introduce yourself real quick?
Hey, everybody. I think Carla introduced me. I would say the reason I'm here is because I do handle our denials for Matthew and have had great success doing that. So I want to be a resource. If you want to ask questions, I'm going to take you through, some of the successes I've had, some of the challenges we've had, and give you some of the tips from kind of in the weeds, if you will. But happy to be a resource as well if you have specific questions.
Great. So thank you so much for joining us, Michael. Okay, so let's start with that concept of, well, before we even get there, there's some different factors that might make the outcomes different for different people. So I can speak about my experience as a parent in Florida with my son on primary and secondary insurance. So he's on Florida Blue. He has secondary insurance through Medicaid. And then we also have the waiver as a payer of last resort. However, your outcomes and the number of denials you get, the ease with which you're approved or denied services for your child, that really can vary based on a lot of different factors. So if you live in a different state, you might have policies that have different eligibility, different coverage, and that's going to affect the outcome. So, like I said, Michael and I can really speak to our experience in Florida with our son who is 10 years old and on both primary and secondary and payer of last resort. It also can depend on the diagnoses. So if we're on this Zoom, it means we have a child with a Phelan-McDermid syndrome diagnosis, but having some additional diagnoses is going to help with getting things approved. For example, a lot of families struggle getting ABA services approved by their health insurance until they're able to get that autism diagnosis. Same with other things like different therapies that might not be covered unless you have like a lymphedema diagnosis, then you might be able to get additional physical therapies covered. So that can make a difference too. So none of this is a one size fits all solution. It's really going to depend on the person's individual circumstances and situation. Just a quick overview of the claims process, and please, Michael, if you have anything to add with this. It's a lot longer than just, submitting it and getting a denial or an approval, right? So that's one big thing I want you all to take away today is there's always a next step. There's always another path forward. If you get a denial, do not be deterred. There is always another way, okay? It might be difficult. It might be something they don't advertise or want to help you with, but there's always going to be another way forward. So generally, you're going to submit your claim. Usually the provider will do this, but you actually can submit the claim yourself. You can look at the claim and give feedback and make sure it's correct. Then you would either be approved or, in the scenario we're going through, denied. At that point, you can appeal. So you can provide additional information, but you're still going through the insurance company that originally denied you. So you're asking them to look at it again. Sometimes it's called a reconsideration. So that is an appeal through that original same group of people that looked at it the first time. If that's denied, then you're going to have an opportunity sometimes to do a second appeal, sometimes not. So this one can kind of depend if there's additional context or something else that you want to add. But often the next step would actually be this third-party review, which can also be called an IRO, which is an independent. It's basically another party, external from the insurance company, supposed to be taking an unbiased look at things, which, may or may not be the case. Um, at that time, that will either be denied or approved. And then often the next path, if that's denied, would be a fair hearing. So that's going to be going before a hearing officer. And it's going to be much more of like a legal process, and presenting your arguments to that officer who, from my perspective, it feels like you're going before a judge. It can be kind of intimidating. And the third party, or in some cases, the insurance company, they're going to have the opportunity to present their side of the case as well. So then the hearing officer is going to make a decision, which is called a final order, coming out of that. And if that is denied, you still have the option of going forward for a state level judicial review. Um, which I think after that there's more options of appeals and whatnot. So there's always a next step. Some of these things can take months. Michael, I'm sure we'll talk about our son's fair hearing we recently went through, but basically in the 5 months it took to finally get an approval, they were still paying for the services that whole time. So as long as you're meeting the deadlines and going through the steps, and dragging out this process, you can often still get those services approved in the meantime.
So I think it's important
Got
to
anything
point
there?
out that I think this is actually, to use kind of technology terms, I think this is a feature, not a bug, right? I think that it is a feature that there are so many steps and so many processes that you can use. Call me skeptical, right? Because I probably am. But I think that the majority of the time, the rejections are, I don't want to use the term rubber stamped, right? But there's an immediate rejection, and then there's all of these processes that you can follow. This is a lot. What Carla just presented, all these opportunities are a lot, right? And they almost count on you not following through and not taking these steps, right? So that the original rejection sticks. What I think we're both going to encourage you to do today is follow the process, right? Because this is a feature of the process. Reject, 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 and you have multiple opportunities to change their mind. Take advantage of that. They are counting on you stopping. They are counting on you feeling burdened. They are counting on you not being able to meet a deadline. Again, that's the skeptic in me, whether it's true or not. That's how I see it. So the more you follow this process and take on a dogged attitude, right, of I'm not going to give up, your chances of success are far greater. So again, I think this process is the way it is, purposefully. And I think the more that you have that dogged attitude of I'm not going to give up, I'm going to see this through every appeal process that there is, again, your chances of success go up at that point.
I think I think that's a really good point. And it's expensive for them if you keep going through the process. So of course it's not in their best interest to have people who are determined and willing to problem solve and keep going forward, even in the face of something intimidating. It can be daunting. So yeah, I agree with all of those points. And we'll get to some more things about that a little bit later on. So that's just an overview of the process. It can look a little different. The second appeal might not be in there. They might call it something different, like you might see the third party review called an IRO, but generally this is what the process will look like. And then after that state level judicial review, Michael, would that be a appeal to that? So I know there's a point where it would go to the state Supreme Court, right?
Yeah, there would. For Medicaid, it would be the judicial review, and then it would be some sort of appellate process beyond that.
Yeah, so there's always a next step. That's the one thing I really want you to walk away with today is there's always another path. So again, going back to that idea, we're trying to, before we even get denied, trying to have the claim be submitted properly, and prevent that denial from happening in the first place, which can be prevented many, many times. So let's look at what some of those things some of those points are. If possible, before the treatment happens, you want to verify that the provider is in network. Those out of network denials can happen. Know if there's a procedure for out of network. Now, this is going to be different if you're talking about, getting coverage for a wheelchair or something like that, but it still is going to have someone who is evaluating and providing the wheelchair. So you're going to want to make sure those are in network if possible. You want to confirm that the service is covered. So that's the concept of healthcare coverage is what you're trying to get for your child or adult, actually something that's covered in the policy. And you should be able to access and read the policy and understand what the coverage, what percentage are you responsible for? Is it totally covered, et cetera? That it will all be outlined in great detail in the policy, which you can request and ask for in its entirety. Um, Often pre-authorization is going to be necessary for procedures, so that's something that the doctor would have to get. So you're responsible for knowing if that's required and for making sure that's been obtained. Um, that's not necessarily something you can go back and get after, so you want to make sure that pre-authorization is done on the front end. When you call the insurance company to ask about these things, um, make sure that you're asked if the lines are recorded and get a reference number, get the agent's name, and keep a little notebook or some notes on your phone or something where you're keeping track of all of that information in case there is a denial and you need to go back and refer to those previous conversations. So those are just some tips on the front end. When you're submitting the claims, they need to be submitted within the deadline. You want to make sure the correct codes are used. So that's a really easy error that can happen and then you get denied. So, make sure you're not getting denied for one of those. We call it with our 12-year-old, he didn't check his work on his math problem, one of those silly mistakes. Um, for medical necessity, that can get a little bit fuzzy, but you're going to be wanting to make sure that if they are having to prove medical necessity, which means not your opinion of whether it's medically necessary, but does the policy support the medical necessity as you see it outlined there? You're going to be referring back to the policy. So you're wanting to attach that type of documentation, which that's something the doctor would probably do. Um, and then if you're not the one submitting the claim, make sure that if you want to, check it over yourself, and ask for copies so you can see what was submitted. And obviously this would be a bigger deal for bigger ticket items, like if you are getting a wheelchair or, a stroller or something like that, you definitely would want to have copies of that claim before it's submitted. Okay, so that's kind of the tips on preventing the denial from happening on the front end. And then once you receive that denial, you really need to understand what it means and what your options are moving forward. So you're going to start by reviewing it, of course, reading through it very carefully. If you don't understand something, or if there's something that doesn't make sense to you, you can call the insurer and they should be able to explain to you. Again, if you make those phone calls, ask for reference numbers and record those in your notes so you have those to keep track of. There's several types of denials, and I'm sure there's probably more than what I've outlined here, but these are the main ones. The silly errors are the administrative denial. So that's if there's something missing or the code is wrong or something like that, that can easily be corrected. Out of network denials, medical necessity. So again, it's not whether someone has an opinion about whether it's medically necessary. It's whether you have to look back at the policy and see what the language in the policy is regarding medical necessity. And if it's Medicaid, you're actually going to be looking at the statute and understanding what medical necessity means. It's not an opinion. It's not, oh, he needs it so bad. It's actually looking at and comparing to the policy. And maybe, I don't know, Michael, if you can speak to that a little bit with the limiting, the language in the statute for Medicaid with medical necessity.
Yeah, medical necessity is an actual defined term, right? So it's going, if you don't be startled by the term statute. So as a piece of background, I think it's important to know about me. I didn't go to law school until 4 years ago. And the reason I went was because of all the denials Matthew was getting and feeling so frustrated about these processes and having success for him and wanting to help other people, honestly. So I didn't know any of these terms. I was, burdened by the same language and everything else. And I don't have the magic answer now. It's just I understand statutes a little better. So don't think of these terms as something you can't understand just because you're not a lawyer, right? I think statute scares people. it's a well-defined term under Medicaid. What is medical necessity? And it lists what that means. It tells you that it must provide relief that can't be found by a cheaper or easier method is one of the bullet points, right? So, let's say PPEC is necessary, is not medically necessary because the child could have at-home care, which is cheaper and more efficient. I don't know, silly example, right? But it's not hard to understand. So definitely on a medical necessity, go through what the statute is under Medicaid, read it, because you're going to use that to prove your case.
Yeah, and I think when we were first kind of going through this journey with Matthew many years ago, I would get really upset on the phone with the insurance company when we would get denied, and I would cry and I would tell them how much he needed it, and how can you not cover it? And that doesn't matter. It really, in this kind of case, is it in the policy? Is it medically necessary? Can you prove that it's medically necessary? So I think that in terms of Michael's use of the word dogged, that determined attitude, take the emotion out and figure out how you're going to push forward, right? Eligibility, so that's really if the patient's eligible for the treatment, that can refer to if they're even eligible for the insurance at that moment, have the premiums been paid, everything related to that. And coverage is that procedure or service covered under the policy? If it's not covered, it's pretty unlikely that you're going to be able to get it covered. You're going to want to review those denial codes and the explanation of benefits, which you're going to get with the denial, so you understand why you've been denied. So if you're unclear about that, you don't understand why the denial happened, that's when you would call the insurer and get clarification.
Let me add one more point here, Carla, about the denials, right, and understanding them. One of the things I often remind Carla, who just said, right, she used to call and cry and think it was personal. None of this is personal, right? So when you look at these types of denials, take logic out of it too. There's no logic or reason, right? Sometimes it doesn't make sense, right? When you look at the denial. And one of the things when you look at an administrative denial or a coverage denial, there may just be information missing. And you logically would say, as I logically say, well, pick up the phone and call me and tell me what's missing and I'll do it. That's not how it works, right? Instead, they're going to deny based on the missing information, and you're going to have to follow this burdensome process, right? This isn't simple. They're not going to pick up the phone. That's not what they do. So if it is something as simple as an administrative denial, understand that it's not personal. They're not trying to, again, skeptic in me, they are out to get you. They're not out to get you in that case. They just don't have a better process for finding that missing information or calling you and asking you about it. It's a denial. That's what they do, right? So understand that too as you go through these different types of denials. It's just a process. It's just what they do.
Yeah, so just whether you're denied for a little coding error or something much larger, you still have to go through that same process of appealing. It doesn't matter. You can't call them and just say, oh, I had the code off by 1 digit. Can you just correct it? No, you have to still go through that process. In addition to, so these are actual types of denials that they would give these as reasons in the denial, that this is language they would use. The hard and soft denials are not any kind of an official thing, but it's more just in general, do these types of denials, are they easier or harder to get approved once you appeal? Okay, so hard denials that are more difficult and sometimes not possible to get approved are eligibility related. So if the person is not actually eligible for coverage or for the services. Authorization related. So if you didn't get that prior auth in ahead of time, that can be really hard, if not impossible, to correct. Non-covered services. So if it's something that's explicitly stated in the policy that it is not covered. I think there have been times when we've actually gotten those things covered, but it's much harder. And then I put these two on both sides. So medical necessity is really going to depend on how well you're able to prove based on what the policy says. If the service or the item you're trying to get covered is medically necessary. So it can be very difficult or not, just depending on what the policy says. And then out of network is the same. you're going to have some stipulations in that policy about when out of network is covered. So sometimes it can be if there's not an equivalent option within X miles or X minutes of the person, or if I think with Phelan-McDermid syndrome, it's actually that is something that's on your side because it's so rare that you may be able to get coverage for out of network just based on whether someone knows about it and has treated it in the past. Okay, so, and soft denials are the ones that are a lot easier. You know, you correct it and submit that first appeal, and then it will be easier to get it approved. So that's if there's missing or invalid data, missing documentation, someone made an error. And again, if the medical necessity is easily proven using the information in the policy or the statute, um, and if you are able to use the policy to prove that the out-of-network provider is needed. So then it can actually be pretty easy to get that approved. So this just to give you an idea, you know, what you might be up against, but of course there's exceptions to all of this. None of this is really a hard and fast rule. Okay, so as you're looking at the denial, you're looking for the reason. There's going to be codes and things. You want to look for the next steps in the paperwork and know your appeal rights and deadlines. Don't miss a deadline. That's really there's not much coming back from that. When you miss the deadline, you might have to start from scratch. Ask the insurer for the copy of the policy. They may be able to email it to you. And often you can actually find the policy, that particular part of the policy online by Googling the name of the insurer. So, you know, United Healthcare plus the name of the device, drug, or procedure. So like Rift and Trike plus the medical necessity guidelines. And that's gonna give you a good Google search that will come back with some information for you about the policy. So this will come to you via email. So don't feel like you have to write that down, but that is a helpful way to use Google to understand what the policy says. Okay, so once you understand the denial, so again, understanding why you were denied, what your process is to appeal, what your deadlines are, then you would begin the appeal process. Now, I've been able to get some insight from someone who actually worked in reviewing these types of appeals, and they told me to really try to assume good intentions. Now, that's a little hard for me to put out there because we've been through the ringer with some of these things, but start with the premise that they want to approve the request, but they can't because something important is missing. The wrong information has been provided, or the policy is written in such a way that the request just can't be approved. So again, I think the takeaway for me is try to take your emotions out of this and tackle the matter for what it is. The fact, you know, provide facts, look at why it was denied, provide clear evidence related to those reasons, but begging them because your child, you know, look at him, look how much help he needs, that's not going to help here, right? So try to do this in more of a little bit removed way, in a way of at least emotionally. So you can write the appeal letter. You can also ask the provider to write the appeal letter. Sometimes the provider will just do it for you. And sometimes that's good. So, but just know that you can do that either way. You can do it yourself, or you can have the doctor, therapist, whoever it is, write that letter for you. You can actually use AI to write the letter for you. If you have specific guidelines, you could use something like ChatGPT to help you at least have a starting point for the appeal letter. There's lots of templates online. If you just Google, you know, medical or health insurance appeal templates, you want to make sure you're including medical records. We've gone through a lot of issues with Matthew's prescribed pediatric extended care services, which is basically medical daycare for individuals up to, I want to say it's age 21. In Florida, it's paid for by his Medicaid, but it's really, really hard to get it covered. And so one of the reasons he is usually eligible for this, or he is eligible, is because of his history of seizures. So when we are applying or appealing, we want to provide every single neurology appointment, I message the doctor anytime he has anything that looks like a seizure. So there's notes and messages with the doctor. So we provide all of that. We have dates for anything that we think remotely looks like a seizure. So they have this medical evidence of what they're looking for to approve him, right? If we don't do that, if we don't provide those types of medical records, then he will have a much weaker case in terms of being approved. This is where you would reference, so when you're appealing, this is where you would reference any conversations you may have had on the phone with the insurance company about coverage. So if they said it was covered and then you were denied, you can use that reference number. And they should be able to go back and look at that. We've definitely had examples of that happening where they were able to go back and look at a conversation. Sometimes you have to push that, they don't really want to do it. But that is why you want to record those reference numbers. You want to make sure you're referencing any language in the policy that supports the coverage for your child. You can also use the Phelan-McDermid Syndrome Foundation clinical guidelines about the syndrome and characteristics of the syndrome if that's supportive of the documentation you need. So I'm going to send you guys links to that as well after the Zoom. If you need to send it via snail mail, make sure you're using certified mail and you have tracking so that you can make sure it actually gets there. So those are some tips on appealing. Again, we've said this already, but most denials occur because there's lack of information. You can give your doctor like a one-pager about your child that can help them understand your child's symptoms and issues, which can make the appeal process a little bit easier. So like a one-pager highlighting the issues for your child. Okay. So do you have anything to add there, Michael?
No.
All right. So we have now been denied. We have gone through that appeal process, and we're now hopefully going to be able to get approved at some point along the way with this continuum that we've talked about. Again, you might have to do this many times and continue to be persistent to get that approval in the end. The biggest takeaway, you all, is there's always another path forward. There's always a next step available to you. Okay, these are some resources I'm going to make sure to send out that you can use to support you as you're going through these different processes. But your state is going to have different resources depending on if you're talking about a denial that's through insurance or through Medicaid. Some of these may apply to one but not the other. But I'll send you all of these links to help you. So I think that's a good pausing point to see if there's any questions. I don't see anything in the chat. I think there's some people out there, or if anyone has a situation they want to problem solve. Let's see.
Let me take you through a couple points that we've talked about already, but I think a few more key takeaways, right, from the information that Carla's already provided. She mentioned diagnoses. One of the terms I use, I'm not as, my language isn't always as precise as Carla's. So I say things that, may not be proper. But one of them I say is chase a diagnosis. And I don't mean chase false diagnoses, right? But I talk a lot about getting the diagnoses that your child has because it's going to help. So one of the things Carla talked about with our son is the seizures. He didn't have an epilepsy diagnosis, right? He had seizures, but we never officially had the epilepsy diagnosis. He now has that, right? That diagnosis has been critical in the PPEC services and our appeal of the denial for PPEC services. So it's something that kind of lingered out there that we never went and put a nice bow around, right, in getting the diagnosis, even though he was having seizures. His neurologist was aware of the seizures, but we never took that next step to chase the diagnosis, if you will. Take the time, right? If your child has certain things going on and you know that if you took that next step, you'd get the diagnosis, I would encourage you to go do it, right? Take the time up front because having that diagnosis will only support and assist you getting more services getting more equipment, medical equipment, et cetera, right? So that's something that I think you should think about. The other thing is relationship with your doctors. A lot of our kids, our PMS kids have a lot of specialists. They have a primary care doctor. You might have, I think the last time I looked at our sheet that we have, the one sheet, there was probably 16 doctors on there. We don't have relationships with all of them, but we do have really good relationships with 2 or 3 of them. And that's critical too. And I'll tell you why. When you need to appeal a denial, having a letter written by one of your doctors is one of the best pieces of evidence that you can have, right? So generally, you have to look at this as you are the expert for your child. A claims representative for an insurance company or a representative of Medicaid doesn't truly know your child. They see a piece of paper, right? You are the expert on your child. The more that you can put that expert voice forward, the better you're going to be. The best way to do it is through testimony or a letter from one of your doctors. So in the last fair hearing that we went to, we had, I think Carla collected maybe 4 letters from doctors. So form those relationships with your doctors too, right? Or at least 1 or 2 of them that you can go to and say, look, I need help. I've got an appeal coming up. Can you put together a letter for me? I'll suggest what the letter says, or I'll even pre-draft the letter or something, right, to help them. But the more you can have that relationship with your doctors, the better off you're going to be. The other thing that Carla mentioned too was the PMSF guidelines. I will tell you, even though my wife works for the foundation, I was unaware of those guidelines until this last appeal that we had with Medicaid and the fair hearing. I'll tell you what, I absolutely submitted those as a piece of evidence because those guidelines backed up my argument. So use that as a resource too. The other thing I jotted down, and this is very, very functional for medical equipment denials. We have, I think I've won 4 fair hearings against Medicaid for Matthew. And one of the first ones was the Rift and Trike when he was much younger, right? They said that it wasn't a piece of durable medical equipment that was medically necessary for him. One of the best pieces of evidence I had in that case was directly from the Riften website, right? I went to the Riften website and I checked out all of their materials about the trike. Remember, your situation is probably not unique. The denial you've received is probably not unique. The piece of equipment you're seeking is probably not unique to your child. The service you're seeking is probably not unique to your child. People have been through these conversations previously. Why reinvent the wheel? Let me go find out what arguments have worked, right? So for medical equipment, go to the medical equipment site or the company, right? Because they're going to have been through this. Their entire business, company like Riften, the majority of their business is Medicaid children, right? So they're going to have resources and information that's going to help you. You don't have to make it up, right? You're going to find information on there that is going to tell you how to position medical necessity or what about that trike is functional for kids like Matthew or whatever it may be. Doctors, facilities, same thing. Use PPEC again, the pediatric extended care. They go through denials every day with kids. Let me ask you, PPEC, what language can you give us or what arguments have you heard? Now, by the way, I don't know that they've ever been successful, the one Matthew goes to with families getting approved after denial until us. But I have now offered them all of my resources and said, if there's other families that are getting denied, here's the language that worked, right? So remember that. What you're requesting and what is being denied for your child is probably not unique to you. Find the resources to get the information that are going to help you with your appeal. Go to the doctor. Look, tell me why this is medically necessary. What language can we use? Again, the equipment provider, the doctor, the facility, whatever it is, go to them and ask. The more information you can get from them, the better off you're going to be. So those are three things I jotted down just in the interim here while we were talking. Relationship with your doctors, chase the diagnoses. Four things: use the guidelines and go chase information from the people who have it. You're not alone in the battle.
I think, and a couple things on that. In addition to our clinical consensus guidelines, we also have medical advisories, and a couple of those were actually written specifically to help support families facing denial. So there's one about ABA and why ABA therapy is medically necessary for Phelan-McDermid syndrome. So, we do have a lot of resources available as a foundation. Um, what was your first point you said, Michael?
Diagnoses.
With Chase, yeah, with the Chase the diagnoses, and to reiterate what Michael said, it's not trying to get all these diagnoses that your child doesn't actually have. You're trying to make sure that if they have something that they're dealing with, that they have the appropriate official diagnosis for those things. So right now, Matthew, he's exhibited ADHD behaviors basically since he was a toddler, but we've never tried to get that diagnosis. It's never really felt important, but we are at a point now where we're probably going to pursue that soon just because he clearly has ADHD, and it's just good to have that documented in case it can ever be helpful to him. So I think that's really important. Our families often have trouble getting an autism diagnosis, specifically in California. For some reason, families have a hard time getting that diagnosis. We have an article from our foundation discussing why and how autism can look different in our kids than, generally what you may think of with autism. So that can be helpful in supporting that autism diagnosis, which can again help with getting things like ABA covered, which can be a big lifeline for families and really helpful for their children. So I'll send you links to all of those different things to make sure that you have them. I will send you, we have our QR card. So this is our About Phelan-McDermid Syndrome QR card that you can print from our website, which links right to a lot of those types of resources. So I'll make sure to share that with you all as well. I also want to make sure, because Michael and I talk about it as if everyone knows about PPEC, which most states do not have this type of service. I'm going to describe what it is again, just so you understand. And then I'm going to tell you what states do have it in case it's something that would be helpful to your family. It's not something that's advertised. I think it's very expensive for Medicaid, so they don't really put it out there. You kind of have to find it yourself. But again, it's prescribed pediatric extended care. So it's medical daycare. It's basically like a nursing home day facility for children. So they have to be medically needy, and they have to be, medical enough, which some of our kids do qualify for that based on an epilepsy diagnosis and other, medical needs. And so it's paid for by Medicaid, and Matthew goes and gets full day care by nurses, and they bring in a lot of really fun stuff for the kids to do. They do therapy horses come in, like miniature horses. They have the library come in and read to them. So they make it really fun for the kids. And that's been a great thing for our family and for him when we need childcare and when we need him to be cared for. We can't just hire a babysitter or any person to care for him. He needs someone with medical experience. And in this case, it's nurses. So the states that have that are Delaware, Florida, Georgia, Iowa, Kentucky, Louisiana, Maryland, Mississippi, Nebraska, North Carolina, Ohio, Pennsylvania, Texas, Vermont, and Wisconsin. So I know a couple of you on here are from some of those states. So hopefully that information will be helpful to you if it's something you want to pursue for your child. My child is struggling with gross motor delays, and we're trying to get PT services covered. Our primary insurance is denying services because they do not cover habilitative services. They only cover rehabilitative services. Then Medicaid is denying because the primary insurance denied. What can we do to get this approved for my son? One thing I'm not going to be able to advise you on what to do about this. I'm just going to throw it out there that sometimes our families find the burden of having more than one insurance for their child to be it's actually cumbersome and can actually cause issues. So I do know of families that actually pull their child off that primary insurance and just put them on Medicaid to avoid problems like this. Or we often have this happen where they toss around, like the primary insurance will say we only cover the generic brand of drug, and then the Medicaid will say, well, we only cover the name brand, and they go back and forth and they won't pay for it, right? So in those situations, we've gotten by mostly with using GoodRx, or, we've gotten around it one way or another. But some people, if the medication is really expensive, they actually will drop that primary insurance and just have their child on Medicaid. We have not done that because Matthew's primary care provider does not accept Medicaid, and he's one of those, I like to call them care quarterbacks that Michael was
Yep.
talking about, someone you really want in your corner who's a huge advocate for Matthew. So we're not really willing to go away from him. So we haven't done that, but I do know of families that do that.
Let me answer a little more directly too, right? Because I think that you have options here. And one of them is finding a rehabilitation specialist, right? So one of Matthew's doctors is Carla, correct me, what is Dr.
He's a physiatrist. So that's,
Physiatrist?
yeah, that's what a rehab doctor is. And he heads the PTOT speech departments at the hospital, the children's hospital.
Is that person, that doctor is going to have a different view of what your child needs, right? So he's going to call it more rehabilitative services than anything else. One of the things when you do have your primary and Medicaid fighting, my answer is always, I don't care. Like, you have to figure it out, right? Like, you two have to figure it out, because it's not my problem. I have two insurances, and you can't just deny it saying that the other has to cover it. You two need to figure it out. When you apply that pressure to them, I have found that to be successful. It's not easy, right? But it's ultimately taking it up the ladder, several layers, at either one, at Medicaid or the insurance company, and saying, you two need to have the conversation and figure out the denials that you're basically pushing back against each other. But I think the biggest takeaway, and we did fight the PT battle, goodness, 5-6 years ago. And it, the best piece of advice I can give you is that rehabilitative doctor. That is where I actually went to a fair hearing on that one. And we won because of the letter from that doctor. I attribute it absolutely to him. He said, look, the diagnosis is this. If we don't treat this in a rehabilitative way, then this will become a permanent problem for this child. So that's that language worked. It was almost a scare tactic. Don't deal with this now. This will become a lifelong problem for this child. Let us put these services in place. So I would absolutely recommend trying to go to a physiatrist. He has been incredibly helpful for us for PT services.
Do you have any advice for getting the two insurances to talk to each other? Both of the insurance companies say we all have to be on the phone together in a three-way call in order to discuss.
Yeah,
we have done that. I know we've
too.
done that. Go ahead, Michael.
Right? Yeah, try the call, right? If they're pushing it onto you, and this is where it goes back to what I said earlier, be dogged, be the absolute bane of their existence. Okay, can you hold while I get them on the line right now? I've spent way too many hours of my life having these battles, but they're counting on you not doing that. Ultimately, when you get them together, they have to figure it out. You cannot restrict legally, you cannot restrict services or insurance coverage based on another provider being in place. You can't deny and say they have to do it and create this cyclical environment. But that's exactly what they do.
How do I talk to the same person every time from the insurance company? It's very hard to keep calling back and have to talk to someone new every time. Is there a way to get one consistent person on the phone?
With Medicaid, it's simple. With Medicaid, it's the case coordinator.
Insurance, you want to ask for an onshore representative. That will get you someone in the United States who often, if you then ask for their supervisor, you will be able to get someone who will give you a direct email address or phone number. The offshore representatives are going to confirm with you that you're sure you want to do this, and they'll probably send you to other offshore representatives I'm not, but ultimately, if you have someone you're talking to in the US who's in the same time zone as you or somewhere close by, it's going to be different and it's going to help you and hopefully be able to get to someone that gives you an email address or phone number. And I would make sure you get those reference numbers of the conversations and write them down. What happens if I switch insurance companies while an appeal is in process? Are there any risks to doing that? I don't know really outside of it'll be a pain in the neck in terms
Yeah.
of just logistics. I'm not sure you would have to submit the appeal or the claim and everything through the new insurance company and start the process over. If the coverage ends and the child is no longer eligible for the old insurance because you've taken them off the policy, then if you were to go back to that insurance, you'd have to start from square one again. So would be submitting a new claim. I don't know if you have any insight into that, Michael.
No, I mean, I would urge you to see the appeals process through, right? That's
Yep.
starting over takes a lot longer than seeing it through.
Now, this is not ideal, and I understand that this is not something everyone can do, but there were times with Matthew's therapy that there was not an outcome yet to the appeal, and if we didn't keep going, we were going to lose his spot. They were so tight with their
Yeah.
scheduling.
Yeah.
So we said, okay, what's your policy, therapy clinic? What's your policy around how many weeks we can miss before you give our spot away? And basically, he had to go, I think, every 3 weeks or something. So we had them do like a placeholder where we went every 3 weeks, and he did the shortest possible session, which was like 30 minutes. And we paid, it was not the self-pay rate, because the self-pay rate means you're going to submit it eventually yourself through insurance. We paid the cash rate, which was half what they bill insurance. So that was a way to keep it going it was not really that bad, the cost of it, but it kept that spot for him until we had a resolution from the claims and appeal process.
I think that's a takeaway for everybody, specific to your situation, but very important for everybody to understand. With insurance, you have due process rights, right? And so they have a timeline that they must follow, and they have processes that they must follow as well in alerting you to denials. And they can miss deadlines. And one of the most effective things you can do is catch them when they do that, right? Because then you can absolutely throw at them that you have violated my child's due process rights. I was not alerted to this denial. We continued services because we were not alerted to this denial. X, Y, and Z, right? So I think that's for everybody is understand, again, it's not a huge thing you don't have to go through pages and pages of information. Just know what the processes are, when they are to alert you to a denial. Is it 30 days, 60 days, whatever it is? Know that so that when they don't do it, you absolutely push back that they violated your due process rights. That's something to keep in mind.
I think unless there's any other questions, we're gonna wrap up. We will be continuing our Pathways series next month. So in June, we are doing state resources. So it's a US specific, like a US focus, diving into state resources. So I hope that you all will be able to join us for that. So thank you all so much. If you need anything, please feel free to reach out to me at Carla, CARLA @pmsf.org. And I hope you all have a great day.